Hey guys, my name is Claudicia. Welcome to my YouTube channel. Thank you so much for being here with me today. I hope you're kicking ass, achieving your goals, chasing your dreams. However, if you are not, if you feel that you are stuck in that depression trap, this video is for you. I want you to know that I understand, you are not alone, and I am here for you. If you find yourself stuck in that depression trap and the only thing that you did today was get out of bed just to walk to the kitchen, to get a snack, just to walk back to your bedroom, to climb back into bed, awesome, good for you, keep going. If the only thing you do this week is get in the shower or take a shower today, if that's the only thing you accomplish, spa day. If you are suffering and you feel you're stuck in that depression trap, I just want you to know that you are not alone. I am here for you. I have been there. We are here for you, and this video is for you. Today, I want to discuss medication. I will go over why somebody would be taking medication, what you should know about your loved one who is taking medication, what they did not tell me when I was prescribed medication, and my most recent experience with a particular medication called Effexor. The reason why somebody takes medication such as antidepressants is to treat a chemical imbalance in the brain. Medications, specifically antidepressants, increase amounts of serotonin and natural substances in the brain to maintain a mental balance. Common side effects that your loved one or you may experience when you are prescribed an antidepressant are the following: dry mouth, drowsy, loss of appetite, erectile dysfunction, loss of libido, abnormal ejaculation, dizziness, nightmares. Typically, it takes 6 to 8 weeks before the physical side effects begin to subside and they begin to diminish. If you or a loved one is trying out a new medication, keep in mind that it may be 3 to 4 weeks before, the nausea goes away, loss of appetite. However, it will be about 6 to 8 weeks until you can determine, or the doctor determines, if it is a good medication. If it's not, they're going to have to start all over again and start from scratch, meaning it's going to be another 6 to 8 week trial. It's all trial and error. What they didn't tell me when I was prescribed Effexor. Effexor is used to treat depression and OCD, or obsessive compulsion disorder. What they did not tell me were the side effects that you may experience, such as the following: confusion, mood swings, brain zaps, anxiety, insomnia, nightmares, dizziness, vertigo. What they didn't tell me when I was last prescribed my most recent medication, Effexor, was what would happen if you stop taking that medication or when you begin to taper off of it. With the medication Effexor, if you were to miss a dose within 3 to 4 hours, you will begin to feel that depression. Within 24 hours, you will begin to experience withdrawal symptoms. The withdrawal symptoms are the following: anxiety, insomnia, nightmares, night sweats, dizziness, vertigo, flu-like symptoms, muscle spasms, headaches, confusion, mood swings. One of the craziest side effects that I experience, or your loved one may be going through, are brain zaps. Brain zaps are described as electrical shocks in the brain or the back of the eye. A brain shiver, jolt-like popping sound in front of or behind the eye, along the front of the head, in the back of the brain. It will make you feel nauseous. Believe me, I experience them. Currently, there is no treatment for brain zaps. However, it was last found out that it was approximately 76% of patients taking medications such as Effexor or Zoloft experience brain zaps. The really bad side effects that I was not aware of that you may experience when coming off of the medication are the following: mania, psychotic break, psychosis, delirium, suicidal thoughts, or ideation. I personally experienced each one of those side effects when I was coming off of the medication. One other thing I wish that I would have known about the medication: do not mix it with alcohol. Please do not mix your antidepressants with alcohol. I did not know the side effects that could happen. It will worsen your symptoms. I wish that the doctors would have warned me about the withdrawal symptoms. One thing that really affected me was the night sweats, the night terrors, the nightmares. There were evenings when I would wake my husband up crying. I would have to change my shirt 3 times a night. We would have to change his sheets because I would just be drenched. That medication made my symptoms much worse. I did experience the psychosis, the delirium. My husband says that one of the main things he saw that I was suffering and struggling with were the mood swings. One minute I would be super happy, the next minute I was self-harming. These are just some things that you should be aware of. So if your loved one or you are taking these medications, do the research. I know a lot of people say, don't pay attention to the side effects. You'll think you have them. Truly, pay attention to the side effects. If you are experiencing any of these, let your doctor know right away. I had no idea that Effexor was as bad as it was. I wish I did. It caused quite a bit amount of friction in my marriage with the lashing out outburst. I had no idea. How can you help your loved one who is taking a medication or trying out new medications for the first time? Please be patient. Be patient with us. We are sick as hell the majority of the time we are trying out these new medications. Just letting us know that you're there is really all that we need a majority of the time. I hope that helps. Lastly, the more you know about your loved one's mental health or what they're struggling with, such as anxiety, depression, PTSD, OCD, etc., the more you know, the more you can keep things in perspective. Thank you for watching. I hope that was helpful. I hope you enjoyed it. Please stay safe. Know that you are not alone. I love you. I'm glad you were here with me today. Also, please drop a comment if you have any suggestions or questions. I am here for you. I am here to discuss this. I want to be an open book about it. Please stay safe, be well. God bless.